Welcome. Today, we're taking a journey into the world of urology. And trust me, it's a field that's way more high-tech than you might imagine. We're going to explore how doctors use sound waves to see inside the body, how they deploy tiny cameras for surgery, and how actual robots are changing everything in the operating room. So let's get into it.
Here's our game plan. First, we'll nail down what urology actually is. Then, we'll look at the cool diagnostic tech they use to find the problem. After that, we'll cover some common fixes, dive into the incredible world of robotic surgery, and finally, wrap up by talking about why healing is about more than just the procedure itself.
All right, first things first, what exactly is urology? Let's lay the groundwork and really understand what this whole medical specialty is about.
So, at its core, urology is a surgical field. It focuses on the urinary systems in both men and women, and it also covers the male reproductive organs. You might hear it called genitourinary surgery, and it's a huge field. It covers everything from painful kidney stones to cancers to infertility. It's a massive range of challenges.
And here you can see exactly what we're talking about. For both men and women, urologists are the experts on the kidneys, the ureters that connect them to the bladder itself, and the urethra. It's the whole system that makes, stores, and gets rid of urine.
And this field is so big that it has 7 official subspecialties. I mean, think about it. There's a whole branch just for kids, another one that focuses only on cancers, and even something called neurourology, which is all about how your brain and nerves control everything. It's just incredibly diverse.
Okay, so how do doctors even begin to figure out what's wrong? Well, the first step is always getting a clear picture of what's going on inside you. And the technology they use to do that, it's pretty amazing. Before they do anything invasive, the first stop is usually imaging. And one of the most common tools in their toolbox is the ultrasound. It just uses sound waves to create a live picture of your organs. It's completely safe, totally painless, and really, really effective. And this shows you exactly how it works. On the left, a technician is just moving a probe over the patient's abdomen. And on the right, you see what they see, a real-time image of the bladder. One of the main things they check for is whether the bladder is empty in all the way, because if it's not, that can cause serious problems for your kidneys. And it's not just for the bladder. That same ultrasound tech can be used to check the kidneys for stones or blockages, investigate any issues in the scrotum, or look for abnormalities in the prostate gland. It really is the workhorse of urological diagnosis. But, sometimes you just need to see things with your own eyes. That's where something called endoscopy comes in. A cystoscopy, for example, uses a super thin, flexible tube with a tiny camera on the end to go right inside and look at the urethra and bladder directly. And the procedure itself is very systematic. First, the patient gives a urine sample and empties their bladder. Then, the lubricated scope is gently guided in. They use sterile salt water to fill the bladder up a bit, which stretches it out and makes it much easier to see the lining clearly. From there, the doctor can look at everything up close and even take a tiny tissue sample if they see something that needs a closer look. So, once you have a diagnosis, what's next? Well, that's when we get to the interventions. Let's look at a couple of the most common ways urologists step in to get the body's natural systems flowing again. So, what do you do when the body's plumbing is blocked? I mean, think about it. If the bladder can't empty, that urine backs up, putting a ton of pressure on the kidneys. That is a seriously dangerous situation. And this is where a pretty simple but absolutely vital device saves the day. The answer is a urinary catheter. So on the left, you see what's called an indwelling or Foley catheter. That goes right up through the urethra and into the bladder to drain urine continuously. But on the right, for men, there's also an external option that works kind of like a condom. It's a less invasive choice if the person doesn't have a blockage problem.
And remember those tiny cameras we talked about? Well, they're not just for looking, they're for taking action. A slightly longer scope, called the ureteroscope, can travel all the way up into the ureter where a kidney stone might be stuck. And it's equipped with this teeny tiny basket that can literally grab the stone and pull it out. It's diagnosis and treatment all in one.
Okay, now we're getting to the really mind-blowing stuff. We're moving beyond small scopes and talking about full-on surgical robots that have completely changed the game in the OR.
So here's the biggest difference. Instead of one large incision, like in traditional open surgery, a robot uses several tiny, keyhole-sized ones. For you, the patient, that means way less pain, less blood loss, and a much, much faster recovery. And for the surgeon, they get an incredibly magnified 3D view of everything, something that's just impossible with the naked eye.
Robotic surgery is also a huge upgrade from an earlier technique called laparoscopy. See, laparoscopic tools are basically like rigid sticks, which limits movement. But robotic arms have wrists that can bend and rotate just like a human wrist, but even better. You combine that with the leap from a flat 2D screen to immersive 3D imaging, and you have a massive jump in precision and control.
And this is what it looks like. The surgeon isn't standing over the patient anymore. They're sitting at a console, often right in the same room, using hand and foot controls to guide the robotic arms. Every single move they make is translated by the robot with just incredible, steady precision.
But of course, no technology is a silver bullet. These robotic systems are incredibly expensive to buy and maintain. They might not be the best choice for a fast-moving emergency situation. And sometimes, a robotic procedure can actually take longer than a traditional one, especially as surgeons are getting up to speed with the system. But all of this amazing tech, from the ultrasound all the way to the surgical robot, it all serves just one purpose: healing a person. So for our last section, let's step back from the tools and focus on the human being at the center of it all.
Real healing is so much more than just a successful operation. For someone dealing with a serious urological condition, the emotional and psychological toll can be huge. A truly holistic approach recognizes that and takes the whole person, their mind, their spirit, their emotions into account on the road to recovery. And this idea, this need for support beyond just the clinical, is a universal one. This quote here really captures that. It talks about the power of a compassionate community and showing empathy for people facing health challenges. It's a powerful reminder that healing is often a team effort.
And that brings us to our final thought. We've seen technology that can look inside our bodies, pull out tiny stones, and perform surgery with the precision of a robot. The challenge for us moving forward isn't just about inventing the next amazing machine. It's about making sure our compassion and our ability to treat the whole person grows right alongside it. Thanks for watching.